Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I'd like to do a social media skin trends update. All these social media skincare trends, some are good, some are neutral, some are actually bad, and some are just useless and a waste of money. So are they worth it or not? Let's give each an expert assessment. Today, I'd like to go over the top 5 topics of this year that I get asked about in no particular order. Let's go over oral collagen supplements, estrogen cream for the face, beef tallow as a moisturizer, red light masks and red light therapy, and wrinkle patches. Let's tackle together whether these 5 are helpful, harmful, or neutral. Let's start with collagen supplements. These are oral supplements of apparently collagen that people eat, usually as a powder. Somehow, this is supposed to increase the collagen in the body. There is no evidence that this does anything whatsoever. I do not do this. I'm very concerned about losing collagen, and I do not eat collagen powder. I think eating collagen supplements is a total waste of time and money. However, I don't think it's typically harmful to do this, so if it floats your boat, it's up to you, but I do not recommend it. I recommend eating a healthy diet with lots of fresh fruits and vegetables, organic when possible, whole foods, good protein sources, drinking lots of water, limiting sugar, etc., etc. That's what's good for the body, and what's good for the body is good for your skin. The thing that's going to protect the skin the best is sunblock. I don't think collagen powder does anything. But I would say that supplements that come in jars that you can buy at the pharmacy or the health food store are not closely FDA supervised. So I am concerned about the quality and the content of these big jars of powder, and I'm not convinced that what it says it is 100% the ingredient list. And so, since there's a chance that there could be some things in there that might be harmful and potentially harmful at high doses, I say take a pass on the oral collagen supplements and don't waste your money. Moving on. How about estrogen cream for the face? So you want to put vaginal estrogen cream on your face. There is no evidence that this does anything. The loss of estrogen is an issue for women as we age, but putting vaginal cream on the face at this point is unproven. And to be honest, even oral estrogen in hormone replacement therapy, I do not believe that there is any evidence that this helps the skin per se. It is known to be good for the bones and the heart, and it is theoretically possible that either oral estrogen or estrogen cream could help the skin, but we just don't know. And remember that vaginal estrogen cream is meant to be used in the vaginal area, which is mucosal thinner skin, so it gets absorbed better. It is very unclear if that same cream will work on regular facial skin. I do not think it's harmful per se, but it is not proven, so I do not recommend it at this time or prescribe it right now. But from my perspective, I'd say take a pass for the moment and await further research on this. Next up is beef tallow as a moisturizer. I have some patients who buy this and use it and love it. And go ahead if you want. I'm sure it works just fine as a moisturizer. It's basically oil from a cow, an animal product. So that said, there are plenty of non-animal product moisturizers. The best natural one that I can think of is coconut oil, but there are lots of moisturizers out there as well as regular creams. The thing about the beef tallow is not to use it if you are acne prone. It will definitely make you more prone to clogged pores. That is true of anything oily. So that is really my only warning on this. But if you are not acne prone and you like beef tallow, I do not think it's harmful, and it certainly is a moisturizer and will definitely improve dry skin. So if beef tallow is your preference, I say go ahead. It can be helpful. It is not harmful. I do not per se recommend it, but it's fine if you like it. The only caveat is do not use this on acne-prone skin. Now let's talk about red light masks. This is probably the number one question I get for the last year or two. These appear to be everywhere, and I would just say that any light device that is legally sold for home use is basically weak, as they need to make sure that people will not burn themselves or hurt themselves by using it. So I don't think that these red light masks do very much. I didn't say that they do nothing. They do have some effect. I just think it's very small. We have been using red light, blue light, and actually all wavelengths of visible light for decades in our office, and this is called IPL, otherwise known as intense pulse light, otherwise known as BBL, or broadband light, or photofacials. There is a whole podcast on this. I will link to it in the show notes. These three things are basically the same, and they are much, much stronger than the home use red light masks. I have been highly recommending IPL and photofacials for fair-skinned patients as part of an anti-aging program for decades, and we have seen over many years the stimulation of collagen from these treatments. Some patients even get what looks like a little mini facelift from the skin tightening when they do this for many years. It is not guaranteed, but it is common for us to notice this. So for the home devices, if it was a gift or you already own it, I don't have a problem with my patients using red light masks. I just think they are very weak and not worth the time or the money, so I don't recommend them per se. They might do a small amount of anti-aging, so if you like it, go ahead. But if you are considering a purchase, I'd say see if you can handle a much stronger in-office treatment that gives real visible results, such as IPL, BBL, or photofacials. Last but not least, let's talk about wrinkle patches. This is a new hot topic. I've been doing a lot of field research on this topic and testing out many patches of different brands. They seem to come in three varieties. The temporary patches that have some ingredients in them for temporary short-term use for about 15 to 30 minutes. Then there's an overnight variety, typically made of silicone, that are reusable. And there's also an overnight variety that are disposable single-use overnight patches. So I find the temporary wrinkle patches for 15 to 30 minutes to be nice for moisturizing the area, giving a temporary glow, especially under the eyes on sensitive skin. So if you find a temporary patch that you like, I don't have a problem with people using it, as long as they are not irritated and they have no allergy to the ingredients. However, I have fallen in love with the overnight silicone reusable patches, especially personally for my forehead, but they also exist for other body parts, eyes, cheeks, neck, chest, etc. The patch causes pressure and it helps smooth out the skin and it helps prevent sleep lines from forming. Sleep lines are really annoying for many people, myself included, and if you can, it's best to sleep on your back for anti-aging purposes, but for many of us, it is impossible, and we smash our faces into the pillow, and over time, as we lose collagen and get older, permanent lines start to show up, especially on the forehead, but also on other areas of the face and the body. The silicone overnight wrinkle patches really help prevent this from happening, and I have added them to my regimen. The downside is you cannot use your skincare underneath them. You can't put on Retin-A or retinoids or acids and then occlude it. You will get irritated. So they have to go on clean skin. And you need to move your skincare program either to the morning, if it's possible. This doesn't work well with most retinoids, but something to discuss with your dermatologist. Or you can rotate things at night, and some nights use the wrinkle patch and other nights use your skincare program. It really depends on what is the most important thing to the particular patient. If you have skin issues and you need your particular products, then an overnight patch is probably not for you. But maybe a temporary patch would help smooth things out. I would also say that some people might not love the silicone patches because they can get kind of gross with repeated use. It's like a thick tape being put on your skin, and when you take it off, it does take dead skin cells with it. So they can be washed, but they just get kind of yuck over time, and then you need a new one. They might last a couple of weeks at most. But if you don't like the silicone, there's also overnight disposable patches, and they typically have active ingredients in them, And I do like those, and I will sometimes use them. I don't like them as much as the silicone, but for people who can't tolerate or don't like the silicone, they might like the overnight patches. I find that they do not do as good of a job on the sleep lines because they are not as strong with the pressure on the skin as the silicone. But in any case, if you like the temporary patches, they can give a quick boost. I particularly like the overnight patches. My favorite is the silicone for wrinkle prevention of sleep lines. And so wrinkle patches are helpful for certain patients. We do have some available at our office these days. I use them myself almost every night. So in summary, for our social media skincare update this year, collagen powder is not recommended. Estrogen cream on the face is not recommended, but we're waiting for more research. Beef tallow is available should you want it for your moisturizer. Red light masks are weak, but may have some positive effects. And wrinkle patches are really useful, especially to prevent sleep lines. I hope that was helpful. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.